Because I think you're providing really valuable information, and I think it's super important. And I feel like women, especially now, like I'm almost 40. I have friends who are like, my body feels uncomfortable. Like my brain fog is at an all-time high. My sister and I were talking about my own health issues, and she's like, "Do you think you're experiencing symptoms of perimenopause?" And I was like, "Yes, because I've been talking to somebody who's been telling me about all the symptoms, and I definitely feel like I am." And so I think that there's just so much education here, and being a cis female, it is pretty incredible to think that there's so much more information for the transgender community. And it's not that they don't deserve to have that. It's just, why is there not even at the very least an equitable distribution of resources for this other portion of the population? And I'm curious, and I don't expect you to necessarily have an answer for this, but it's kind of interesting to consider how, like, why that decision was made versus like having more information on cis females sooner even.
It's a good question. I think it's because we've been ignoring the problem. And we've also been thinking that estrogen's really dangerous, but testosterone's not dangerous. So it's not dangerous to give women testosterone, but it is dangerous to give them estrogen. And I think this myth has been perpetuated for way too long. So we can start to look at it now, and we can take what we've learned from this body of literature that we've already done for this population that's been really helpful for them, take it and even extrapolate and use it to help cisgender women now, right? So we know some interesting things, and it may not change. Some women feel great on on a little bit of testosterone, and it's fine. It's really more about how you feel, but we can learn a little bit about pathophysiology of the body from the literature. And so one of, like, for example, things that we can glean are vaginal health is a really big area that we can look at, and the different sex hormones and how they impact vaginal health. And this is like what I think are this, and then our metabolic health. And these two things we know for sure. So for example, when you give a woman only testosterone, even in small doses, and you don't give her any other hormone like progesterone and estrogen, and this is actually really common practice for a lot of HRT clinics. They will only give women testosterone. They'll tell them that, hey, your testosterone's low and all these other hormones are normal, supposedly. Maybe we just don't know how to interpret the labs, but they're just telling them that the testosterone's low because it's the only reference interval that's been optimized, right? It's the only one that we've actually done the literature on. So testosterone's the hormone that we have. And so they'll start having them inject that, and we see that the vaginal microbiome becomes incredibly disrupted. So what happens is when we talk about microbiomes, usually we want them to be diverse, right? So in the gut and the skin and everywhere, we want them to be diverse. But in the vagina, we don't want diversity there. We only want like a few strains of bacteria or organisms that maintain the pH, right? So we want that pH to be really acidic. And Lactobacillus acidophilus is the predominant one. There's a few others that researchers have found that are there that keep the pH really low, so it's acidic. And this prevents HPV infections. It prevents yeast infections. It's an area that's open to infection, right? So we want to make sure that you don't have infections there. And this is, the Lactobacillus acidophilus is incredibly important for that. It really crowds out all these other bacteria. So when they start to have perimenopause symptoms, they start to get more yeast infections or bacterial vaginosis. And bacterial vaginosis is simply just bacteria diversity that's there that's not supposed to be there. It's not really from like sexual partners or increased sexual interaction. It's really just from this low pH that's not being maintained, that's supposed to be there. So they're susceptible to even their own skin flora, like getting into the vaginal cavity. And so when we give somebody testosterone, so this bacteria needs estrogen to make its food. And I think this is what we've learned from the literature, is that women, when you give them only testosterone, they're going to develop this diversity in the microbiome that shouldn't be there. They will get they're more susceptible to vaginal infections unless you give her estrogen too.
Wow. That's really interesting. I definitely feel like that's so important for people to know. I feel like this is the type of stuff that is not only not getting enough research, but it's not getting enough airtime to even make people aware of these either deficiencies or imbalances that they have, and to be able to hear from you, knowing the experience that you have and the expertise that you have, I think that's just like it feels like getting, a head start at this point, even though I felt behind when we started having these conversations. I feel like there's so much more that like I even know to be curious about. You know what I mean? It's like I wouldn't even know the questions I should be asking about my own body if you weren't explaining some of these things to me. And that's like I encourage, as I'm sure you do, being in the field that you're in, like curiosity, experimentation, like, have a healthy sense of skepticism and look to the science to prove the points. So when you don't have people who are as informed, sort of just saying whatever they're going to say, with maybe they feel like they have resources that have given them insight, but they haven't done enough to expand on that. And they're sort of stuck in the mindset of this is what works. We're going to just keep doing this. You don't really understand how prolific that effect is until you sit down and really sort of look at the broad picture that you've been painting for me over these many conversations that we've had. I feel like my entire world around my own hormonal health has like opened up because of this. So I'm incredibly grateful for that and for the people that have the opportunity to learn from you and your business and your work that you do.
Thank you. No, I think it's really, like you said, we need to be asking the right questions. We need to be skeptical that this status quo or the norm really shouldn't maybe be the norm. And women have they have the choice. And so, and I think this vaginal health, like I've talked to a lot of women that are on testosterone only, and they feel like they're gaining muscle, they look great, and even if they're on a healthy dose that they kind of feel okay, they said they have all kinds of vaginal problems. And so there's like one area that they're like really wanting to fit, and you can't fix it with testosterone. Another thing that we see happens to the metabolic system. And this is insulin resistance, which we're all getting more and more aware of, causing problems like diabetes, heart disease, increasing risk for heart disease too, and weight gain, right? So it's really just like a lot about for women who are just wanting to maintain their weight. Insulin resistance plays a huge role in that. And testosterone causes insulin resistance in women, especially when it's too high. And we know this in polycystic ovarian syndrome patients. When testosterone gets up to above 300, around 700, these patients can get this high, which I mentioned that, this is where you start to see facial hair, deepening of the voice, acne, hair loss on the scalp, and large amounts of weight gain. And this is the testosterone that's doing that. And it's because it's causing insulin resistance. Women need estrogen and progesterone to maintain our healthy metabolic system, to maintain weight, to lose weight, to appetite suppression, so we don't eat too much. This is all regulated by estrogen and progesterone. And there are a lot of companies and providers that will argue otherwise. There's probably a lot of conflicting literature, but there's no doubt that we see in the transgender literature and we see in the polycystic ovarian syndrome literature that too high of testosterone causes a huge metabolic problem for women. I don't think anybody can show otherwise. I think the question is whether these small amounts of testosterone are good, and they're probably good, right? Again, we want it in this right ratio and amount in order to help women maintain lean muscle mass. But large amounts really cause women to gain weight around the midsection.
I'm curious in terms of the metabolic side of things. Obviously, gut health is sort of at the forefront of the discussion for a lot of people right now. I just, with the foods that are out there that are maybe like not providing any nutrition and are more toxic than anything else. And so I'm curious if in terms of the work that you've done from a hormone perspective, like, are you seeing that there's a shift also like that's required in diet to help with that in conjunction with the hormone treatments? Or, I realize that might be more correlation that you might not be susceptible or not be privy to when a client comes in and stuff. But like, are you recommending anything with hormone treatments? I know from InnerBalance, I'm getting stuff around like here, these are supplements that can be helpful for you. Some of those are digestive enzymes, things like that. So like, how do you, let me round out this into an actual question. What do you suggest in addition to hormone therapy to augment what you're doing and how the body's responding to that for clients who are looking to improve their metabolic health, who are looking to feel better sort of all around? Because as you and I've discussed previously, it's not solely the hormones. There are lifestyle choices and things like that that are involved.
Yeah, I think it's a good really great question. And there's a couple of answers here. And one is there's a lot of research around, estrogen being metabolized by the gut microbiome or even being produced. And we know that the gut microbiome even produces testosterone. Is the gut microbiome an endocrine organ? Is it really how heavily is it involved in either metabolism or production of hormones? And I think we're just starting to touch on this and understand these pathways. We do know from a clinical perspective that when hormones drop, we see a ton of gut issues, right? Like women having really sluggish digestion. And this kind of comes first because the motility of the intestines are all regulated by hormones. The gallbladder production of bile is regulated by hormones. And as I mentioned, this GLP-1 pathways to lose weight and maintain our sense of fullness. And so we don't overeat. That's all maintained by hormones. So we see the hormones drop off and then the digestive system and the metabolic system get disrupted from that. And even the microbiome. And then women are trying to chase it with their diets, right? Well, maybe if I just changed my diet and did this and this, then I could feel better. And I see women doing that for years. Even PCOS patients, polycystic ovarian syndrome patients, they think if they just change their diet and eat really low carb, then they'll fix that insulin resistance and then stop the testosterone production and lose weight, and then everything will get fixed. And really it was an underlying hormone problem that you have to address first. So, but you're asking, what do you do for this population that once they start hormone replacement therapy? And I think the reason why we have to worry about that is because they go a long time without hormones and the gut becomes so disrupted. And we need hormones to maintain the mucin lining in the gut, right? So it helps produce this mucin basically that maintains integrity so that you don't get a leaky gut. You don't get stuff going through the pores in the intestine into the bloodstream. So a lot of women that suffer from leaky gut and small intestinal bacterial overgrowth and all these problems, they really do need hormone therapy because they're not making estrogen and progesterone to help preserve the gut. Everything's linked together, right? The immune system too is regulated by hormones, and our gut is our main area of defense, initially. What happens is they'll go a long time without hormones. And then women, when they start hormone replacement therapy, the hormones start really activating everything. They stimulate the gallbladder, they stimulate the intestines to start moving. So women that were previously constipated may no longer become constipated anymore. But as the gut becomes adjusted to having hormones again, they can get bloated, or they might feel, and this is less than 10% of clients, but there it can happen, and it's more of this feeling of bloatedness. It's temporary, but sometimes depending upon how bad the gut is, you have to address it. And that's why we recommend supplements to help, because really working on the liver and gallbladder health is important. And we have women are eating a lot of fiber, for example. They're told to eat fiber to help with the constipation, and they're told to eat. And this can cause more or worsening symptoms of bloating because you've now, and microbiome is dependent and the diversity is dependent upon what you eat. If you're a large meat eater, you're going to have a different diversity of microbiome than if you eat plants. And this can all change on what you were before you started the hormone replacement therapy. So it is important that women just know if they have bloating, that they can, it's easy to help, with the liver and gallbladder functioning. And that's really where your focus, your energy, and then the bloating goes away. And it just takes time, and it takes another 1 or 2 supplements and some work with specialists like myself at InnerBalance. We help women through this period. But you're right, it's so intimately connected with gut health and hormones.
Yeah, that was a great response. So thank you for helping me understand that. And I do have one more question on this matter because it just popped into my head as you were saying, if you eat more meat or versus plants, do you see a notable difference in sort of what's required in terms of hormone treatment for somebody who is vegetarian, vegan versus somebody who is a meat eater?
Yeah, this is a really great question. And I find that this is just my own experience working with women, and it's not I think you should eat what you want, and we should be able to support your health so that you can eat what you want. Not necessarily eating, but if you're a healthy whole foods eater, if you want to eat plants versus animals or eggs, or, you should be able to eat these things. And I feel like your digestion should be healthy enough to support your diet, not the other way around, that you have to be so restrictive. And so I don't really have an opinion one way or the other. I think people can have healthy diets with other choice, but I've seen that when women tend to lean towards a plantful, a vegetarian or a vegan diet, they have a little bit harder time with starting HRT just because they get more bloated. And I think this is about a gallbladder functioning less when you have bacteria that's in the small intestine that should be there. We call it small intestinal bacterial overgrowth. And this is because the gallbladder is not releasing enough bile, and bile kills this bacteria in the small intestine. It's not supposed to be there. And when you look at purely like a meat eater that doesn't eat a lot of plants, they don't have as much of that bloating issue. And it's a lot of it's like the different types of fiber. We tend to think of fiber being in, and I know this is a little bit off topic. This is really, I think, important. People just kind of start thinking about this, that when we think of fiber, we think of plants, right? Like seeds and plants and nuts and soluble fiber and insoluble fiber. But meat fiber is fiber. Like the tissue within the meat is actually made up of the small branch fatty acids and the medium chain fatty acids that bacteria need to thrive and grow. Meat eaters like get plenty of fiber. Like that's what they're like. People don't tend to think of that way, but that's the actual food that we need in order to get the bacteria that's supposed to thrive in the gut to grow. So meat eaters don't actually have, and fiber just makes more poop. Like when you eat more plants, you just poop more. Like it doesn't like it's just all it does is like bulk it up. And there's a lot of, so a lot of physicians will promote like, having more than one bowel movement a day and all this. And I just find that, it's, again, meat eaters tend to have as much bloating. The gallbladder seems to be like responding and eliminating bile. The choline is really, really important for the gallbladder to function. And women have this like ability, this like superpower where they actually have a gene that allows them to make choline. We can synthesize choline. Choline is like this really important, like essential nutrient for the brain and the gallbladder and all these functions in the body. And we have the ability to make it because we have babies. And it's so important for brain development in the fetus that during pregnancy, estrogen stimulates this gene. Like estrogen turns the gene on so that we can make choline so that the baby has it. So that even if there's like a food shortage or like a woman doesn't have eggs, because egg yolks is like the primary source for choline, and then fat like meat. And so if she's, maybe our ancestors, if they went a period of time without meat and eggs, then she could make choline for the pregnancy. And so this is like obviously a protective mechanism that the body has. But when she goes through perimenopause and there's no more estrogen, she can't stimulate the gene that makes the choline in order to just stimulate the gallbladder. And she develops these like intestinal problems, and it's a choline deficiency. And we're told that eggs are bad, right? So now we're making everybody more unhealthy. So and so there's this eggs are unhealthy because they have cholesterol. And I guess now the FDA says they're not. But, this is, so women who have eggs and meat in their diet tend to do better, like I would say.
Yeah, that's, thank you for sharing that. And the small intestinal bacteria overgrowth, is that SIBO? I forget how, one of my friends was navigating that, or thought she was navigating that, trying to figure out things with her gut health. So I was like, that sounds familiar. Acronyms go. Okay. So
if women were to connect SIBO to the gallbladder and this choline deficiency and estrogen, and so this would help her a lot, like in her journey, and knowing that like estrogen does help with SIBO, or maybe that's even potentially the cause of SIBO. So something to think about. Mm-hmm.
Yeah. So in that sort of situation, if somebody were dealing with gut health issues like that, would you recommend that they do some sort of assessment of like their hormone balance and to understand if that's like maybe the place to start, rather than thinking like my diet's going to be the fix here?
Definitely. Like they'll chase their diet all day long. And again, you shouldn't have to have such a restricted diet. I think that women will, but the problem with that is they'll get hormones and they'll quote unquote be told they're normal. So like we've not, but if they're having gut issues and that severely that they're having to fight SIBO or leaky gut, they really should be thinking that this could be an underlying hormone problem, especially if they're over the age of 30. And to think about like, do I have other symptoms? Like maybe I'm like really so focused on my gut health that maybe I do have some anxiety, but I think it's my gut, or I'm not sleeping and I think it's my gut. And they've been told by practitioners that you have anxiety, you can't sleep, and your skin and hair look terrible because you have a leaky gut. And so they'd spend all of their time focusing on trying to fix the gut, when it's like, No, your root cause of all of these problems is actually hormonal, and you fix that, and then you may still have to work on your gut a little bit, but it would be much faster if you had hormones on board.
Yeah, that's super interesting, Sarah, especially because I think about like, a lot of people probably look at it and go, I think I am fighting the root cause because I'm looking at the gut, right?
Yes, they think their root cause is the gut.
Yeah, so there could be like one layer deeper that maybe we're not even looking at.
Exactly. I think it is one layer deeper. I think that like a lot of the core root causes, the hormones drop off first, and then you start to see the problems.
How did your experience as a woman in medicine shape your approach to building and leading InnerBalance?
That's a good question. I think before medical school, I was an engineer. So both medicine and engineering are predominantly male dominated fields. But I think that benefited me, right? You get a lot of grit and you will experience like being in these male dominated fields. After medical school, I became a pathologist, which is also probably primarily male dominated right now. But this training allowed me to look at everything differently, really. And I don't think that I got caught up in the gender part of it. I was so interested in the science and the body and the physiology that I don't think I really cared that much, that I was probably the only female in my engineering graduating class or something that didn't really, I think there was a few of us, but I always was looking for a better solution. And I think that trying to solve problems and being a pathologist, this is different than other doctors. Like doctors are typically very specialist trained. OB-GYNs, they just know surgery. They just know that reproductive years or how to deliver a baby or do pap smears. Pathology, you have to know everything. You become the doctor's doctor. You have to know how all the diseases are formed in the body and how to treat them all. And this is...
I'm sorry, can I interject for a second? How do you retain all of that information? Like how does one not only learn it, but then also hold on to that to be able to practically apply it in your business?
Yeah, I think for me, I found like it's always been very easy to like this is just something like this is, school is always very easy, and like do this kind of work was very natural, but piecing it all together and looking at a holistic part of the body. And when you talk about the problem solving, like I'm a total nerd. Like I would geek out, literally spend hours thinking about the immune system. Like how would you solve a problem like an immune system? And I did nonlinear dynamics, like a dual degree in mathematics, and I did nonlinear dynamics and chaos theory. And when you look at modeling the immune system, for example, with mathematics, it's like over 11 dimensions. And it is like one of the most fascinating parts of the body as well. And we know very little about it. Like autoimmunity is rampant. Like women suffer from it. It's one of the probably most ignored things because we don't really have effective treatment for it in medicine. But you actually can provide the environment that it needs if you know enough about it. And this was one of the first things that I wanted to solve because I had struggled with autoimmunity in my early 30s. And so this was a problem I wanted to solve, right? And so I think having the mindset, it wasn't so much being a woman, but it was just being in these like different fields and looking at coming as an engineering perspective, coming as a pathologist, entering into hormone replacement therapy with all of this knowledge, right, of these different fields and approaching it in a different way. That's how innovation happens. Like when we have a problem, this, InnerBalance is a solution out of necessity, right? This was simply a problem for myself, a solution for myself. And I think when you want to innovate it, you want the best thing. I wanted the best thing for myself, right? And I realized that I could give that to everybody. And that women deserved like this something new. Like we haven't had any innovation in hormone replacement therapy since the 1960s. Biest cream, this is like a topical cream that is prescribed all day long, was invented by a man in the 1960s, and nothing's been created since. So I really have like maybe this engineering problem solving mindset that I took to my own problem. And I think that's what's probably helped.
Yeah. Yeah, I appreciate you sharing that. And also, on a completely personal note in regard to this conversation is like, I very deeply admire your ability to not just retain it, but to find a way to like practically apply it and to be able to show up in a way that sees that as sort of altruistic to be able to give that to other people, and to want to not just sort of leverage your knowledge and benefit from that, but to share that knowledge, and in sharing that knowledge, identify where the gaps are also, because that's like a big part of the conversation we just had, right? Like women's health isn't getting the attention that it deserves or needs. And so I feel like having somebody come in with the background that you had and then leaning into the medical field from there is quite unique. I mean, I certainly know I don't know everybody in this field, but I feel like if more people with that mindset, like you said, sort of the engineering problem solving mindset, were going into fields that weren't purely sort of tech related, but like biotech, or thinking about things that are going to give people more benefits in the grand scheme of our overall well-being, versus just like sort of building the next app, right? Like there's other places to put that attention. And as somebody who spent years in tech, I don't want to minimize that stuff. I think it's still super important, but I feel like this is a really incredible way for those experiences to coalesce and create what you've been able to build with InnerBalance.
Thanks. And I really like how you said that gap, because that was what we're trying to, that is, and it is ginormous blind spot or gap that's happening right now and that needs to be filled. And so that's, I love that you said that. And we've really made this progress for men, and we're a decade behind. And this is, where InnerBalance was like, hey, I can. And so it wasn't like it happened overnight, it was many years in the making, actually, and realizing that, wow, we can really actually make this huge impact. And it works for so many women.
So what prompted you? Like, did you have a moment that you look at and you remember like sort of it clicking and being like, I think this is what I'm going to do? Or what was the evolution of InnerBalance in that way?
I think the evolution was like seeing over and over and over again how different men were treated than women, even my own way of treating men in my clinic, just because that was how I was trained, right? I was trained even hormone replacement therapy. I learned through the Academy of Anti-Aging, like these, there's pretty set protocols. And I learned that, and to see how we approach men's hormone replacement therapy, we replenish them to youthful levels, right? This is what we do for men. And for women, it's very much, we need to lower your estrogen. It's dangerous. It's very harmful. You know what I mean? This is stark difference in the way that we even think about. And sometimes I would sit back and be like, does nobody else see it? Am I the only one that sees the sexism? Like, this is so sexist. Like, I just don't, like, am I really the only one that sees this? That testosterone's great. It's the best thing in the world. It's so great. We're even going to give it to women. But estrogen is terrible. It's awful. We're going to block it in men, and we're going to lower it in women. Like this.
Yeah.
And so I really started to see like how, like even the conversation that we were having about the different sex hormones was suppression of women. And I've, been experienced suppression, like being a woman in a male-dominated fields, engineering and medicine, you experience sexism and suppression all the time, right? So it's obvious when you see it. You know what it is when you see it, right? And this is just another form of that we can hold women back. We've been holding them back. By simply keeping them away from their own natural hormones is another form of suppression of women, if you really think about it. And I don't think doctors are doing it intentionally. I think there's this underlying bias that we still have towards women, and we really have it towards women over the age of 30. And so this is where I was like, this is wrong, and even I highly respect a lot of really smart practitioners that are doing HRT in the country. And they're all trying to help women. They're all trying to do their best to make everybody feel better. And so I was like, but we still could do better, right? This is something that we can do a lot better in. And then I met my business partner, and that was probably the turning point, because I don't know how to do anything online, marketing, nothing, right? Like, I'm a doctor and an engineer. And so my business partner is an e-commerce genius, and really, really was inspired by the story of women's health and this gap. And I think he had his own story about the women in his life that he knew. And so this is where we were like, let's just do it. We can make a huge impact and really help women. And this is where, and it wasn't until I met him and knew that I had the support, like, because doing something online is totally different than a clinic.
Yeah, definitely. Well, in terms of that, like, what challenges did you face in getting the ball rolling for InnerBalance? Because when you and I speak a lot about what you're doing, we're talking about the actual treatments, right? So there's like a very hands-on interactive component related to healthcare, but there is a tech backing to this business, right? Like this is a product that you have developed. There is an online component to it. So can you share a little bit about sort of like what it was like navigating that, and if there were any hurdles you sort of had to overcome? Because once you get into the medical space, there are also a lot more like regulations and compliance and things that you have to be considerate of versus like selling, just sort of like a random product that doesn't affect somebody's well-being.
Yeah, no, I mean, there's a lot of barriers and challenges, and we've encountered every single one of them starting InnerBalance. And one of them, is funding. I guess we could talk about that as being a barrier. Like the less than 1% of female founders in the US get funded. So that's a barrier there that the Rockefeller Group published this, that very few female founders, less than 1%, get funded. And then not only that, we preferred to have seed money because this would help us get started so that we could pay the best and the brightest to help us. And nobody gets seed money, really. This is like, you have to be building a business for years before you get investor money. And we got both. We got funded and we got seed money. And this was one challenge that we were able to overcome, because we had, it's interesting how many our investors are male, and my co-founder is male, an investor, and then the investor group and our dev team, and they are all extremely supportive of InnerBalance and women's health. And I found that I've gotten more support, and I don't know if this is just my experience, but the women investors were more critical. They seemed less supportive. At the surface, they wanted to help women, but I think we still maybe have a habit of bringing each other down. This is something that we do. Potentially, we need to stop doing this to each other, because we should all, when women get better, everybody benefits, like the whole family.
Rising tide lifts all ships, right?
Yes. And and men, I think, are really getting on this faster than women are. When men see that their wives are struggling, that their moms struggle, that their sisters and daughters. I mean, this is, all of our investors had a personal story about their women in their lives that they've seen struggle with endometriosis or hormone problem or going through perimenopause, and they see that they're getting turned away by their doctors. They're not getting the right help, and they've all seen it firsthand. And of course, our development, we're a tech company, we're an online tech company, so our dev team is outstandingly wanting to help women too. And we're mission forward. Like always, we talk about the mission regularly, that this is what we're trying to do to keep because this is what's motivating our entire team. So this has been the benefit of, even though there are regulatory challenges, there are everything. There's a challenge with everything with this kind of business. But the mission is so worth it, and being able to help so many women, it's such an easy thing to get over. Okay, this is another problem we need to solve, because we have this end goal that's so fulfilling, and it really is. Every time we hear a client say, "You changed my life," or "You've made all the difference for me," then it's okay, we're every time there's a problem, you're well, we're doing it for these women. Yeah. It helps a lot.
Yeah, I love that. I'm actually really surprised and quite disappointed that women who have the opportunity to fund businesses for other women would be more hesitant to do so. I think that obviously part of that probably lies in their beliefs on the nature of the product, right? And so I'm curious, did you find that there was resistance from female VCs because of their thoughts on hormone therapy, or was there something that was distinct around that felt off to them? You can share that if you want to. You don't have to, but I'm just kind of curious if there was hesitancy because they felt it was controversial.
So we knew that it was controversial. Even our current investors knew that it's a chaotic field, it's controversial space. And the idea is that we want to come in with the right information for women, right? They have no answers. Everything's a lot of misinformation. We want to clarify all of that for them. And so everybody knows the field is controversial, but it won't be very long. It's everybody's injecting a weight loss drug that was controversial 5 years ago. And now it's everybody, the shiny new object everybody wants. And so when people find that hormone therapy actually works better than these, so I don't think it was not necessarily as it, we didn't really get a lot of feedback, but none of the female investors were in it.
Yeah. It's really tough to hear that because I've worked for a lot of startups and I have, been beholden to, to shareholders in my time as well and sort of seen like, why certain decisions get made and things like that. And so it is really, I think it's it's empowering to hear that the investors in InnerBalance have these personal stories. They have intention really associated with your mission. Because listen, people who are investing because they see it as a good opportunity for themselves too, right? Like they're not, yes, it can be philanthropic in some way, right? But there is absolutely a motive if you're investing in some way. And so I think the fact that it's not just, oh, these people, particularly men, are hopping on board to sort of like capitalize on a moment where women's health has this opportunity, but that they can directly associate that to a story in their own life, I think makes it all the more meaningful, especially as I imagine as a female founder.
I agree. Like it's inspiring actually to see like men are so supportive of women getting better. Like I think I wish, something women could see and understand that I hear it all day long that men really do want to see their wives not suffer through perimenopause and menopause. They really do want to like have their relationships good. They want to see the woman that they've always loved. Like I hear from men a lot. In fact, we hear men say, "Oh, you've made a product for us." Actually, they see it as like something that benefits them when the women in their lives do really well. So I think this was probably unexpected for me to actually see so much of it, and it's been eye-opening, and I've loved seeing the response that we've gotten from men.
Yeah, I think especially in this day and age where it can feel like there is a lot of tension between the genders, and globally speaking, and there's a lot of oppression of women and things like that. And so I think it's super important to have the backing of people, whether that's financially and or emotionally, who are in our corner as females. And I'm curious just because you mentioned, so you have your business partner. Do you think that having a male on your team also influenced getting the funding? Or I don't know enough about sort of female founders attempting to get funding on their own versus having like a counterpart who is male. So do you think that having a male counterpart in the business did also play a role in helping drive funding for
I
InnerBalance?
don't think it was his gender. I think it was his past experience. So it came in with like a very confident, track record. And so this helps with investors as well because it's, wasn't they were inspired by our story and our mission. They want to see that you have grit and that you're going, this is like advice for like, women founders, but it's really the experience, not only the commitment, but like the ability, just, I think that experience is, I don't know. Yeah. Well, my credentials as well, you have like a great, it's the team, right? So they're investing in you, but the team as well. And they want to have a lot of confidence that is like going to be obviously successful. And it wouldn't be, if it were just me, like a doctor trying to figure out an e-commerce business, right? This would not get a lot of confidence in investors, and having a really good dev team and e-commerce partner, whether they be male or female. I think it was the collection of expertise to make the InnerBalance team that's so powerful.
Yeah. So I'm curious with the funding, because I'm not sure how this works in your case. So to get the funding, like how far along in the business were you when you were seeking that out?
We had already proved concepts, yeah. And we were acquiring customers and had already gone through that. And we, personal investment. And so we both had made personal investments into the company in order to get that far. And we probably could have gone farther, but we wanted to do it sooner than later just to have support. And I think, and so it really depends on the company, I think, and where you're at. And so why we made the decision to do it when we did was like a various number of factors. It was probably not out of need as so much as there's a lot of excitement about perimenopause and menopause right now. So catching, yeah, it's a perfect like the tide is changing. I mean, HRT has undergone this like horrific smear campaign for like 2 decades, and we've completely like ruined estrogen's like reputation. And so I think that's turning, that pendulum swinging the other way. And so we wanted to capture that because we know that women are really starting to learn the truth. And so pretty soon we'll be ready to like be able to help them. And that's kind of why the time. Does that make sense? Like timing also played a critical role. Mm-hmm.
Totally. Timing is of the essence, particularly when you have a lot more information being circulated now. I mean, there's just so much more content on menopause, perimenopause, hormones in general. And I mean, it would have been really unfortunate to not have been able to move forward with your business at like really such a pivotal time. So yeah, that makes total sense.
And with our product being so unique too, and like innovative, I think it really like we knew we could make an impact. And I think that also like drove that decision.
Yeah. Well, I mean, it also puts you in a really strong position in the market too, right? There's something to be said for, being first to do certain things. And because you have like this very innovative angle to it, coupled with the fact that there is this tech e-commerce component, it's like, it's very easy to work with you. It's very, fluid in terms of the setup that you have. The onboarding is very distinct. It's personal, right? Like, I mean, I asked you, the other day, we were talking about sort of the onboarding experience, and I had mentioned something, and you said that one of your employees at InnerBalance, Jamie's so great, and I was like, Jamie's been texting me. I didn't know if Jamie was a real person. AI is all over the place, right? And so it was really nice to know that Jamie is an actual human being that you're working with, right? So even just the attention to detail in that, and being mindful of, this is a very personal process for people. This is something that, things come up as you're going through the experience, and to know that support is there because you've intentionally cultivated a team of people who are driven by this mission, I think just further amplifies the opportunity that's in front of you, because there's just like a lot of really good pieces that have come together, even just in talking to you, but in my own experience, having actually like worked with InnerBalance as well.
Good. No, it's good to hear. Thank you for the feedback. Yeah, everybody loves Jamie. She's so great.
Yeah. So was there ever a moment as you were going through this, because you said, the mission has been really the driving force for you. Were there ever any moments where you were questioning your decision to get going on this, or feeling like maybe, it wasn't going the direction that you wanted to? Because like, since I've known you, it seems like it's been pretty smooth, but I know business, and you've mentioned roadblocks. So like, have you ever felt discouraged at any point?
I think that this entrepreneur online business, like this is really hard. Like, I don't want to give the impression that it's not anything but hard. And there's always challenges and roadblocks, but I feel like my team is so great. My business, I wouldn't ask for a better business partner. And I think that's key, is when you have like a really good team, you can do anything. And so this, I've not ever had a challenge so big that it was that discouraging, because it's just another problem to solve, and you have a team that can do that. And again, when you're always have this like, this impact and mission, and you have this really clear vision of what's ahead of you, this makes it really easy to solve these problems. Like, it's just another problem that needs to be solved, because ultimately I think this would be much harder for companies who are just selling like face cream or something, like with no mission, you might give up or something.
Well, I think to your point, it's it only gets you so far. The idea only gets you so far, right? It's the integrity of the mission that I think really drives progress and helps create more trust also with the consumer, right? Like, you're very involved in this process from what I've seen, and you're able to speak very clearly on why you're doing what you're doing, the importance of doing what you're doing. There are a lot of people running businesses out there who are just like, how can I drop ship this? How can I, make a quick buck? There's so many ways around doing the gritty work. Which, listen, I don't blame people for it. Like, I get, like, people need to be making money. I understand that desire to find a way to do it fast, to capitalize on the moment. But I think, what stands out to me about the way that you're doing business is also that you have a baseline of integrity that says, we're doing this for a reason. We have a very clear idea of who we want this to be able to support, and what the benefit that we are seeing from that. So it feels to me like there's also like, it's harder to feel discouraged when you're living in your purpose, which is just to sort of reword what you're saying. I'm witnessing that as an outsider looking in, and it's very unlike a lot of companies that I've worked with who are just like, how do we make this big enough to sell? You know, which listen, again, it's like if people are going that direction, it's not to condemn that. I just think that I've worked at companies where the conversation every week is like, we're going to be a unicorn. We're going to be a unicorn. We're going to sell. And I'm like, do you even care at all about any of the other stuff that you're doing? And so it's really reassuring to me as somebody who spends so much time in tech to hear somebody speaking to it with so much passion and to use the word again, integrity around it, because I feel like that is something that can get lost in the shuffle in a lot of these businesses.
I agree. But we don't talk about, I mean, this is my purpose. And you're right. It's hard to get discouraged. It's actually fun to wake up every day and be like, it's such a good purpose. Like, it's amazing. And it's very, like, if you're working towards your life purpose and you're gonna, like, you're going to change lives, like, it's pretty cool. So I agree with you that, but no, definitely lots of fun problem solving. Like, I've learned so much, obviously over the last year. It's it's crazy.
Well, okay. So one last question here. Did you have any female mentors or role models in business, or whether that's for InnerBalance or in medicine and things like that, that really helped motivate you also, like somebody that you sort of saw and were like, okay, I don't necessarily want to say aspire to that, but be inspired by that and sort of carve your path with that in mind?
I, honestly never had any female mentors. Like, I can honestly, they were always, so again, engineering, medicine. So all of my mentors were male, very supportive of like advancing females in medicine and engineering. And they, so no, I think that what I aspire to is really this, it's somewhat shown in what we, our values of InnerBalance, but it's not so much InnerBalance, but it's just maybe what I aspire to. And I think that really it's kind of this idea of what we should be setting the norm for women. And I think that's what, and it's just me making it up. It's not anybody that's like doing it or a mentor, but it's, and I'm sure there are women out there doing it. Like, there's no question, but none that I can name. But I do think that we should be establishing, women are this status quo of like being in, for example, I'll just give an example, like what seems to be like, from my perception of all my friends and what I see clients and women, they're inundated with beauty products and how we're expected to age and look like and be like and feel and kind of be suppressed and just put up with this suffering like for a long time. Like my mother did it and our mothers did it. And we're this kind of idea of what beauty might be as we age, whereas men don't have these expectations. And so I aspire to like health is beauty. Like, when you're healthy, it's beautiful, right? And, you can prevent, like, you can keep your beautiful hair and skin, bone health, digestive health, heart health, like having, when your whole body's functional and like you have this really long health span, that's amazing. That's what we should all aspire to, is health, and not necessarily like the aesthetic, but it's fine. I get it makes you feel good, but it's also like this healthy aspect of the living, not only longer, but continuing to be healthy the longer we live. And so this is what I want women to not slow down. I want them to be able to keep up with their kids and their grandkids. So when they're in their 40s and 50s and 60s, they're like on the floor playing with their kids and they're hiking and they're doing cardio or they're doing whatever they want to do. And that's the expectation for women, that they're happy, they're healthy, that we're not pushing pharmaceuticals on them or antidepressants or like sleep aids, that we have a natural solution that they can really, and that's what they can aspire to and not have to. They literally have, I'm so surprised how much we market to push women into these beauty products and like, you know what I'm talking about. I don't know how to like,
so yeah, there's just this constant expectation of like the next thing that's going to solve the problem. And it gets back to something that we were saying earlier on, which is addressing the root issue. And I feel like I can say from someone who didn't know really anything about hormones at all. Like, really, I'll be honest, like I was blissfully unaware. And speaking with you just really enlightened me to the reality of my own anatomy, my body, like what's happening inside and what I need to be paying attention to, what might be symptoms of things that are going on that I just sort of wrote off. And again, like, I mean, I don't want to be like I'm almost 40 because I did just turn 39, but like I'm leaning into to 40 more than I am 30. And I feel like this sense of ownership of my well-being that I was able to sort of disregard before because I was healthy enough, right? And it's so important to, as we're getting older, really acknowledge when those things start to feel off, not just being like it's a natural point of progression. It might be to some degree, right? Like bone density, muscle mass, things like that. I mean, I've been reading some articles about how I better get my butt to the gym because I got to like keep my mobility in shape, right? But I do feel like there's probably some skepticism around what you're doing because so many of us didn't have the knowledge, and that's not to invalidate, the types of treatments that people offer. It's just that if you don't know and you're not being well educated on it and you're trusting sources, or not even trusting, you're hearing from sources that you don't know if you can trust, I can understand why you're like, I don't know how I feel about that. That might be unsafe, or I don't agree with that. Like, to each their own. You have to find the right thing for you. But I really feel strongly that there's so much compassion and purpose in what you're doing, that having these conversations and giving people the opportunity to hear it from a very pragmatic perspective is honestly what more of us need, rather than just somebody sort of sorry, my dog's like running over there from I think people need to hear it from a more pragmatic scientific perspective, rather than sort of just random influencers trying to get you to buy something or to engage in something that they're doing. It's like, what is it that's actually happening, and then you get to make the choice.
Yeah, I appreciate that. No, you're true. Yeah, you're right. I'm glad to see you on your journey. It's very exciting.